Okay, so before I do anything in a patient's room, I'm going to knock on the door and tell them who I am and ask if it's okay that I come in the room. Then I'm going to verify I have the right person, ask their name and their date of birth, and usually there's a picture of them in the MAR and the PCC that you can verify that is who you're talking to in case they can't talk or whatever. You can also look at the band on their wrist that says who they are. So, if I have the right person, I'm going to wash my hands, put on gloves, and ask him if it's okay if I can do a neuro exam, a physical assessment on him. He says yes. I provide privacy. I shut the curtain, shut the door, make sure he's comfortable. Ask him if he has any issues going on that I need to be aware of so that I don't cause them any pain. Because most of the time they're there for broken stuff. Okay, so I'm gonna assess his level of consciousness. I'm gonna ask him his name and ask if he knows where he is, who the president is, why he's here. That will kind of give us an idea of his level of consciousness and awareness around him. Okay, so the first cranial nerve, I'm going to explain to him that I'm going to test his cranial nerves and his reflexes and make sure that's okay. He said okay. And I already know I have the right person. Cranial nerve number 1 is olfactory, which is smell. So I try to use whatever's in the room. Usually there's toothpaste, and or sometimes residents have peppermints in the room. But usually it'll be toothpaste. So I have them close their eyes and put it underneath their nose and have them smell it. Cranial nerve number 2 is the visual nerve. So that test using the Snellen chart. So I'll have them put up a chart 20 feet away from them. I have them cover one eye and have them read the lowest number line that they can and tell me what it says. And have them switch and do the other eye. Cranial nerve number 3, 3, 4, and 6 trust for like pupil restriction. So I'll get my pen light out and I'll put my hand here in the middle, in between their two eyes, and have them look forward at me, and I'm going to just test their pupil restriction. I'm going to take note of what it is before I shine the light in their eye and then after, and do each eye individually. I'm going to look in their eye, make sure they don't have any abnormalities, obviously, when I look there, but I know that's not testing for the nerve, but I always look that too in my assessment. Okay, so you're also testing for their 6 fields of gaze with that, so I'll have them look straight forward at me. I'll hold a pen and go near and far to their nose, and see if, their pupils react to that, and have them look straight forward at me and go up and diagonally and diagonally and diagonally and follow it with their eyes. So you're testing the movement and motor of the eye. And then I'll have them look straight forward at me and hold up, fingers, and to have them tell me how many to test their peripheral vision. Okay, so that's for those. The next one is trigeminal. So it's number 4. You're going to test their that also tests for like their facial sensation and jaw strength. So I'll have them open and close their mouth and kind of hold my fingers here and test to make sure there's no clicking, make sure there's no abnormalities or growth or lesions, any kind of discoloration, infection going on when I'm looking at that also. And then okay, so I'll rub something soft on their cheek and just see if there's any facial movement twitching. Okay, so that was 4, right? Yeah, that was number 4. Okay, so number 5 is trigeminal. Yeah, oh, that was, yeah. I'm so silly. Okay, so trigeminal is the facial section. 6 was part of the 6 fields of gaze. The hearing is the one that I missed last time. So I already recorded this video once and I forgot the hearing, so I had to redo it. But So I will also whisper in one ear and have them tell me what I say in each side. That's for the acoustic, which is number 8. I forgot that last time. And 7 is facial nerve, so I will have them puff out their cheeks, smile for me, and make sure that everything is symmetric. Number 9 is glossopharyngeal, so I usually have them smile, take a sip of water, and make sure they swallow and say ah. That actually is test number 9 and 10 for swallowing. Okay, so the vagus nerve is the uvula, and to make sure it rises and falls. To test for hearing, the doctor will also sometimes do a Weber or Rhines test. We don't do that. The accessory nerve. So I got facial. Deucens. Okay, I'll make sure I didn't forget any this time. Okay, so the vagus nerve is obviously the saying ah and swallowing, make sure it rises and falls. Accessory, so you're going to have them shrug their shoulders by pushing and have resistance, and make sure that they have strength, and have them turn their head side to side, and make sure there's no any abnormalities there. And then the 12th nerve is hypoglossal, so I'll have them stick out their tongue. And yeah, just make sure that, and have them at the same time look under their tongue, make sure there's no lesions or cysts or anything, or worse. Okay, so those are the cranial nerves, and then we're going to test for reflexes. So on the tricep reflex, you're going to tap the tricep tendon. So the forearm will be hanging loose, and the tricep should contract. So you just hit it, and the tricep should contract. The same, kind of the same with biceps. So you're gonna have them flex their bicep, which there's no muscle on Mr. Bowen's here, but anyways, so when they flex their bicep, there'll be a cord-like tendon. You put your finger on it, and then you use the hammer, and you hit the hammer on your finger, so you're not hitting their poor tendons, and then you'll see a reaction there. The brachioradialis, you're gonna hit here, just on the inside, 3 inches above the wrist, and see a reaction there. On the knee, you're gonna do below the knee, and you're gonna hit, and then their legs should go out like that. Achilles tendon, you're going to hit on the back of the Achilles tendon, and you'll see their foot should go out. So biceps, triceps, brachioradialis, patellar I did, Achilles tendon I did, and plantar reflex. So I will have them, they're laying in bed, so I will have them push up, put my hands on top of their feet, and have them push up against my hands. And then I will put my hands underneath their feet and have them push against my feet, and make sure that they have equal strength. At that time, I'll run my finger down the bottom of their foot to test their Babinski. Let's see. So that's also kind of when you test the dorsiflexion on their foot, to make sure that you push down on their feet and have them push against. That tests the dorsiflexion and flexion. So I will do all that while they're laying in bed. If they can't get out of bed, then I'll do the heel to shin test, where they take their left heel right below their right knee and slide it down to the top of their foot, and then do the same with the other one. Okay, so after they're all doing all that, I can have them stand up and touch their nose. And then also test for Romberg. So I'll have them stand up, put their arms out, and close their eyes, and see if they sway. If they sway, then usually that's a sign of vertigo. And you'll count how many seconds they can stand without swaying. Also, I will have them, before I did the legs, I'll have them grab my hands and squeeze as hard as they can and test their equal strength. I could do the gravesthesia and stereogenesis, where you could put a sharp object or soft object in their hand and have them close their eyes and tell me what it is, and also write a number in their hand with my finger and have them tell me what it is. Same thing with their foot, with the sharp and dull object, see if they can identify the feeling of it. And after I'm all done with everything, I make sure they're comfortable. I always ask if they have any questions. If there's anything else I can get them before I leave the room. I make sure their bed is low to the ground. If they have like respiratory issues, make sure their head of the bed is semi-Fowler so they can breathe easier. They should never be lying completely flat. And, I make sure they're all covered up and comfortable, and I open the curtain and open the door. But before I open the door and touch the door, I'm going to wash my hands before I leave the room. And usually I just push the door open with my elbow. I don't use my hand. But that's pretty much it. That's it.